I want you to think of this exercise like a line from the movie True Romance, where Christian Slater's character, they're in an elevator, and they're going into the climactic scene of the movie, and he has a gun on him. And somebody says, "What are you doing with a gun?" And he says, "Look, it's better to have a gun and not need it than to need a gun and not have it." That's how I want you to think of this exercise. Now, I'm not at all promoting gun violence. I'm not at all promoting gun ownership. It's just an analogy here. What I am saying, though, with this exercise is if you need it, you're going to be really glad that you've got it in your back pocket and you know how to use it, because this can be super, super effective. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and today I'm going to be showing you an exercise called Flexion in Step Standing. As I alluded to in the introduction, it's an exercise or a movement that we don't need very often. Our patients don't need it very often. But when it is needed, it can be just the thing that they've been kind of looking for to get rid of their low back pain or sciatica. There's a couple of ways to know that this might work for you. Okay, one, and you kind of have to have both of these going on. If you've tried any of the extension-based exercises that I've taught you in previous videos, if you've tried extension and lying, if you've tried extension in standing, if you've tried those and they've all made you worse, that's a clue that this might work for you. In addition, you have to have also tried the flexion-based exercises. So we've done so far flexion in lying, flexion in sitting, flexion in standing. If you've tried those and they've either had no effect, meaning you do them and they don't make you better or worse, or you do them and initially they seem to make you better, but then in the end there's no effect at all. Those two things kind of got to be in play. So you've tried extension and it makes you worse. You've tried the other flexion exercises and they seem to help, but then in the end they have no effect. Those two things going on, then this is likely going to be a very good exercise for you. In order to do flexion in step standing, you need a piece of equipment, you need a chair. Typically, what is done, the side that you're having the pain on, so we're going to say I have right-sided pain, either low back pain, or it could be on both sides, but it's worse on this side and or it's going down the leg on this right side. That side's going to go up. You're either going to put it up on a chair, or if you have a low table that's firm, up on that low table. If you have balance issues, be careful. You want to be next to a wall, or you might have something here that you can hold on to for balance. When you do this motion, you want to bring your shoulders to the inside of that knee that's up. Down I go, hold 1 to 2 seconds, and then back up. We're going to do this in a rhythmical fashion. Go down, hold 1 to 2 seconds, and then back up. Each time returning to that fully upright position. Is lean forward with my shoulder coming to the inside of the knee. You go down, hold for 1 to 2 seconds, and you come back up into the fully upright position. Down I go, hold 1 to 2 seconds, up I come to the fully upright position. You want to get to end range. So in order to do that, we're going to use a little overpressure. Down I go, you're going to grab the back of your ankle. We're not pulling hard, we're just trying to go farther into our range. Down I go, I'm going to grab the back of my ankle, and then pull, hold 1 to 2 seconds, and then back up. Maybe you can see I just go a little farther in the range. Down I go, pull 1 to 2 seconds, and then back up into the fully upright position. Okay? Or, I just started doing this today. You go down, you can actually grab the chair or the surface, and then pull that way. All that matters is that you're getting farther into your range. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, showing you how to do flexion in step standing. The dosing for flexion in step standing is 5 to 10 repetitions every 2 to 3 hours, or is needed for pain. So if you do this exercise and you find that you're pain-free for 4 hours, then do it every 3 hours. Or if you do this exercise and you're pain-free for an hour and a half to 2 hours, then do it every hour. Stick to the dosing that works for you, and over a matter of a couple of days, your window of being pain-free and moving better is going to be longer and longer and longer. So you get to the point where you're not doing this exercise that often. You might go to just 1 set a day, to maybe just 1 or 2 sets a week, to maybe not at all. But stick to that dosing that works, do it consistently, and you will get better. If you like what you've seen, subscribe to our YouTube channel and click on the little bell so that you'll be notified each week when we upload a new video. Share the video with your friends, like the video, and leave comments below. Let us know if you've tried this exercise and how it's benefited you. Let us know if it's made you better, and even if it's made you worse. Because if it's made you worse, we can suggest little tweaks and modifications to the exercise, which will make it more beneficial for you. Or we can steer you to another exercise, which is probably going to be more appropriate for you.